Hi, I'm Margaret Martin, Familiar Guide, and today I'm going to share with you a little more input into my experience with bioidentical hormones, and as my husband puts it, into sex, drugs, and rock and roll. So it has added a lot more spice back into our life, and so the drug part is what I want to share with you. My journey into, finding the actual, bioidentical hormones and who was going to issue them to me and how was I going to determine, what were the hormones to take. So you might have seen an earlier blog a few years ago when I was, reading books and trying to do my own research on bioidentical hormone replacement. So I thought, I live in Canada, it's socialized medicine, so I have a GP, and so it was a logical place to start. So I approached him with my concerns, and I was afraid he was going to go that way. He really didn't have a lot of knowledge. He was sympathetic, but didn't have a lot of knowledge. So he was willing to do a hormone, blood test on me, look at my testosterone and estrogen and my progesterone. But when the test results came in, you could tell he was kind of like, not too sure where we were going with things. Other than he goes, wow, levels were like so low in some areas. And so I thought, well, I, didn't want to be the blind leading the blind. So I approached a naturopathic doctor who I knew had experience in hormone replacement therapy. Unfortunately, she can't prescribe hormones. So that's just the situation here. So she started writing up recommendations for my doctor. So I was taking her recommendations and trying to, coach my GP along with how to do the bioidentical hormones. And it was just pretty erratic. It was just, I didn't feel like I was moving in the direction I wanted to move in. He would prescribe a couple of hormones. I would start feeling a little bit better. I didn't know if I was at my optimum level. And when I asked him if he would, do another blood test, he was like, well, are you feeling better? I go, well, yes, but I don't know if I was feeling at my optimum. I didn't know if my levels were at their optimum. He wasn't willing to do another blood test. And so that's when I, delved further into research with much encouragement from my husband to do so. And we found a doctor who specialized in bioidentical hormone replacement therapy. It meant a 4-hour travel from the city I live in, but it has been well worth the journey. And so that's all I'm going to share with you today. And so I hope that this has given you a little bit of guidance into the need to be persevering and standing up for yourself. And I will continue sharing my story on the next blog. Thanks for tuning in.